Hello, everyone. I'm Dr. Shreyashi Chatterjee. I'm a medicine specialist, and I also work with patients dealing with diabetes, thyroid disorders, and hormone-related conditions. Welcome to the channel. Today, we're talking about something that worries a lot of people: hair loss. You wake up in the morning and see hair on your pillow. You brush your hair and the brush is full of strands. You wash your hair and suddenly the shower drain looks terrifying. And naturally, people start to panic. Am I going bald? Is something wrong with my health? Do I need a special shampoo? Which hair oil actually works? But here's the truth. Not all hair loss is dangerous, and most expensive hair products do not fix the real problem. In this video, we'll talk about why hair falls out, the most common causes of hair loss, foods that support healthy hair, habits that damage your hair, and when you should actually see a doctor. So let's get started. First of all, some amount of hair fall is completely normal. Most people lose around 50 to 100 hairs a day. That's part of the normal hair growth cycle. Old hairs fall out, and new hairs grow in their place. But if you notice excessive shedding every day, large clumps of hair falling out, or visible thinning over several weeks or months, then it may not be normal anymore. Now let's talk about the common causes of hair loss. One of the biggest causes is poor nutrition. Your hair needs nutrients to stay healthy. If your body is lacking important vitamins and minerals, your hair often shows the signs first. Low iron levels can reduce oxygen supply to the hair roots. Low protein intake can weaken the structure of the hair itself, because hair is actually made mostly of protein. Deficiency of vitamin B12, vitamin D, zinc, and biotin can also contribute to hair loss. So before spending money on expensive hair products, it's important to look at your diet first. Another very common cause is thyroid problems. When the thyroid gland is underactive, hair thinning and hair shedding can increase significantly. And this is especially common in women. So if your hair loss seems unexplained, a thyroid check is often a good idea. Stress is another major trigger. Severe emotional stress, poor sleep, major illness, surgery, or prolonged anxiety can suddenly push a large number of hairs into the shedding phase. Many people notice heavy hair fall a few months after a stressful event. In these cases, changing shampoo alone will not solve the issue. Managing stress and improving overall health becomes very important. Hormonal changes can also affect the hair. This is commonly seen during puberty, after childbirth, or around menopause. Women with PCOS also frequently experience hair thinning and hair fall. Genetics can play a role too. If hair thinning runs in the family, there's a higher chance of developing it over time. While genetics cannot always be completely reversed, early care and treatment may help slow the process down. Another common reason is excessive hair styling. Frequent heat styling, tight hairstyles, harsh chemical treatments, and repeated hair coloring can weaken the hair shaft and damage the roots. Scalp conditions matter too. Severe dandruff, itching, or scalp infections can irritate the scalp and worsen hair loss. Now let's talk about foods that help support healthy hair. A balanced diet makes a huge difference. Good sources of protein include eggs, fish, chicken, Greek yogurt, lentils, beans, nuts, and cottage cheese. For iron, spinach, leafy greens, beetroot, legumes, and lean meats can help. Vitamin C is important too, because it improves iron absorption. Foods like oranges, berries, kiwi, lemons, and guava are excellent choices. For biotin and healthy fats, egg yolks, nuts, seeds, avocados, and sweet potatoes are helpful. Vitamin D is also important for hair health. Safe sunlight exposure, eggs, and fatty fish may help support vitamin D levels. And don't forget hydration. Drinking enough water helps maintain healthy blood circulation, including blood flow to the scalp. Now let's talk about what can harm your hair. Highly processed foods, excess sugar, frequent fried foods, smoking, and heavy alcohol intake can negatively affect overall health and eventually impact hair quality too. Now, one of the most common questions people ask: What is the best hair oil? Here's the honest answer. Hair oils can moisturize the scalp and reduce dryness, but no oil can magically stop all hair fall. Very heavily scented products often contain more chemicals, so simpler and gentler products are usually better. And no, you do not need to oil your hair every single day. What about shampoos? A regular, gentle shampoo is usually fine for most people, but shampoos alone cannot treat the root cause of hair loss. If the problem is related to nutrition, hormones, stress, or a medical condition, that underlying issue needs to be addressed properly. Now let's talk about when you should see a doctor. If you notice rapid hair thinning, patchy hair loss, excessive shedding for weeks, or visible scalp areas, it's important to get evaluated. Your doctor may recommend blood tests to check things like iron levels, thyroid function, vitamin D, vitamin B12, blood sugar, and other nutritional markers. And one very important thing to remember, hair treatment takes time. Most treatments do not work overnight. Visible improvement may take at least 2 to 3 months, sometimes longer, so be patient with the process. To sum it up, hair loss is very common, and in many cases, it can improve once the real cause is identified. Eat a balanced diet, sleep well, manage stress, avoid harsh treatments on your hair, and seek medical advice if the hair loss seems excessive. If you found this video helpful, please like, share, and subscribe to the channel. I'm Dr. Shreyashi Chatterjee. Thank you for watching.